As we begin with our conversations this morning, a new strain of Mpox has been spreading quickly, alarming researchers from the Africa Centers for Disease Control and Prevention, Africa CDC. Since the beginning of the year, 13,700 cases and 450 deaths were reported in the Democratic Republic of Congo. Mpox, also known as monkeypox, is an extremely contagious disease that has been declared a public health emergency in Africa. Joining us with more information on this is the Executive Director in the Ministry of Health and Social Services, Ben Nangombe. Mr. Nangombe, good morning.
Yeah, good morning to you. How are you this morning?
I'm doing great. How are you doing this morning?
We are doing well. Thank you very much.
Thank you for joining us. Perhaps if you could just give us a background of the historical origin of Mpox and what are some of the symptoms we know at this point?
Yeah, thank you very much. The disease used to be known as monkeypox in the past. It has since been renamed Mpox. It is a zoonotic disease. That is an infectious disease that can be transmitted between species from animals to human beings or from human beings to animals. The disease was initially discovered in monkeys in 1958 and in humans in 1970 in the Democratic Republic of Congo. The disease has since been reported in a number of countries in Central and Western Africa, in places like Cameroon, Central African Republic, Cote d'Ivoire, Gabon, Liberia, Nigeria, Sierra Leone as well. So the disease in recent months has been increasing, particularly in the Democratic Republic of Congo. It is understood that there is a new clade of this particular disease, which is now causing concern among scientists and epidemiologists. It is for that reason that the Africa Centers for Disease Control declared Mpox a public health emergency of continental security on the 13th of August 2024, and a day later, the WHO also declared the disease as a public health emergency of international concern on August 14, 2024. So, as I indicated, the disease can be transmitted from animals to humans and vice versa. It has quite a number of symptoms that include fever, intense headache, swollen lymph nodes, muscle aches, and rashes that appear some days after the onset of the symptoms, and this can turn into skin blisters and crusts over time. So those are the symptoms that that can be observed that are consistent with this particular disease. There are rashes also that can develop, that can be concentrated on the face, on the palms of the hands, and on the soles of the feet. The mouth, the genitals, and the eyes may also be affected as a result of this particular infection.
Mr. Nangombe, the virus has spread to other African countries, including Burundi, the Central African Republic, Kenya, Rwanda. But in your opinion, do you think that it has the chance of perhaps reaching Southern Africa?
Well, there have been cases reported in South Africa, for example, and a few deaths reported in that country. The world has become a global village. People are traveling from one corner of the world to the other, from one part of the continent to the other. So the possibility
declared monkeypox or Mpox outbreak as a global health emergency has happened for the cases and
Hey, are you there?
Yes, Mr. Nangombe, we are here. Unfortunately, we can't hear you clearly. Kindly just talk to us again.
You'll be scared. Let's look at the 5 things that you should should know about.
It seems like we're experiencing a few sound issues there. We'll take a short break and we'll be right back. Welcome back. You're still watching Good Morning Namibia. We do apologize for that mishap. We were engaging the Executive Director in the Ministry of Health and Social Services, Mr. Ben Nangombe, just giving us an update and also just talking to us about Mpox, which is basically one of the diseases that have been spreading quickly. And since the beginning of the year, 13,700 cases have been reported. Mr. Nangombe, are you still with us?
I am still with you, NBC.
Apologies for that. How can communities perhaps better prepare themselves for the outbreak of Mpox?
There's a number of ways in which communities can protect themselves against the spread of Mpox. We have heard, of course, that the infection can take place through respiratory droplets, for example, or through intimate skin-to-skin contact. So it is important that people isolate themselves from or separate themselves from people who have got symptoms that are consistent with Mpox. They must avoid skin-to-skin contact with such persons. Persons must continue to practice good hygiene by the washing of hands with soap and water, by making sure that they avoid contact with the animals that may necessarily be infected with this particular disease, avoid direct contact with any materials such as laundry or bedding that have been in contact with a person that has got symptoms consistent with the particular disease. For health workers, for example, we will make sure that they use effective personal protective equipment, PPEs, when they are dealing with patients, so they will have to have their gowns, their gloves, their respirator masks, and eye protection. The ministry is going to continue to monitor, to detect the cases, if any, were to come into the country. What is important for now is to note that Namibia has not reported any confirmed case or suspected case of Mpox in our country. We are going to engage with stakeholders to make sure that communities are provided with appropriate health education information, and we will launch public health campaigns again in terms of educating members of the public, just to make sure that we are all on the same page. But at this point in time, the nation does not have to panic. We have the surveillance systems in place to detect any case that come into the country. We have the isolation facilities at our health facilities, so that if a person is found to be infected with this disease, they can be treated away from the general population in our health facilities.
All right. Now, speaking of treatment, what are some of the treatment options that are currently available for Mpox, and how effective are they in managing the symptoms and preventing complications?
There are medicines that have been licensed. For example, the European Medical Association, EMA, has licensed a medicine called tecovirimat. It's an antiviral drug that has been developed initially for smallpox, but it was licensed to treat Mpox in 2022 based on the findings that were found in terms of its efficacy. But generally, supportive treatment is provided for the patients in order to ease the symptoms and to treat the complications to prevent long-term complications. So patients are also provided with fluids and other nutritious food to ease the symptoms. Again, if there are secondary bacterial infections that can be treated as indicated.
Does that mean that there is no cure yet?
As I said, there are medicines that have been licensed to treat the infections, and supportive treatment are provided to treat secondary infections. And, of course, people do get treated and they recover. The case fatality rate is not so high. I understand, I think in some instances it can go up to 16%. So if you have 100 people infected, 16 of them may die, but the rest can be treated and recover from the infection.
All right. Mr. Nangombe, any final remarks to the Namibian nation before we let you go this morning?
Yeah, again, it's just to say that we are monitoring the situation. We have our surveillance system in place. We have our prevention readiness measures in place so that if a case were to come into Namibia, it will be detected. We have a strong surveillance system that has allowed us to be able to detect other infections in the country, and we are primed for that. And if anything were to happen, the nation will be informed accordingly.
All right, Mr. Nangombe, thank you so much for talking to us this morning and for reassuring us.
You're most welcome, NBC. Thank you for coming through to inform the nation about this important public health matter.
Always. Thank you so much. That was the Executive Director in the Ministry of Health and Social Services, Ben Nangombe, joining us this morning, talking to us about Mpox. Well, he definitely said Namibians have nothing to worry about, as the Ministry of Health and Social Services is definitely ready to take on this challenge. Don't go anywhere. More conversations coming your way.